Namaskar, this is Dr. Aseem from Jaipur. I am medical oncologist and working there as a cancer physician in Bhagwan Mahavir Cancer Hospital. There is a unmet need for the advocacy group for the cancer patient, especially the lung cancer patient. And this is the Lung Connect, which is a platform which is provided to the patient and the doctors, and there is a conjoint effect that patient can ask their question and queries to the doctors and they can sort it out, and there is a big team behind this which is helping to the patient, and patient can ask their multiple questions to them and get the support in very scientific way. And this is the first group and the first platform in India which is providing the support to the patient. And generally the patient asks to us what should be our diet and nutrition during the chemotherapy period or during the treatment period. So it's the most frequently asked question, and generally they ask in their language like हम क्या परहेज करें, क्या नहीं खाएं, क्या खाएं. तो उसके बारे में ऐसा है कि chemotherapy और other treatment in the cancer usually doesn't require any specific diet. Diet should be homemade, very fresh, cooked food, fruits and vegetables they should eat. And most of the time patient asks like can we take the juice. So we generally say the juice should be very fresh and homely made, not from the outside hotel or vendors the juice, and they can take the smoothies, ice cream, everything. The main focus should be with the calories, because the sometimes patient may feel anorexic or nauseating because of the chemotherapy, but they should try to eat something which is very calorie dense, and diet should be based on the protein and balanced diet. So there is nothing specific, no new thing they should do. Their general diet should be based on their regional basis, like if the Maharashtrian people are eating the Maharashtrian diet, it will work better. If the Rajasthani people are eating their diet based on their ethnicity, it will work better. So no extra emphasis should be on the fruits, dry fruits and juices and other things. They can eat very healthy food, less of spices, and whatever they tolerate the spices they can have. And there is no restriction for sugar, as the misinterpreted by the internet knowledge. And you can say diet and exercise is important, and diet should be like they can eat frequent meals whenever they require, but sometimes they feel not to eat the meal, but they should try it, because otherwise they will feel weak, and there should be there may be fatigue or lack of energy that is not good for the further chemotherapy, because they need to go by cyclical fashion, like within 21 days or within 7 or 8 days they will be getting the next chemotherapy. So diet is a main part, and various kind of the food they can prepare at home, like smoothies and shakes and thick shake, ice cream, and it's very good to go. And you can take the salad and fresh fruit salad, or some creams, and you can anything you can eat, but they should be fresh and nutritious. Sometimes they ask like can we take fried food. So answer to this question is yes, you can, but it should not be overeaten, and any food which tastes you can take, but it should be homemade and very fresh. Many a time patients when they come to know like they have a lung cancer, they just feel very depressed, and they feel like there is an impending doom of death, and the caregivers also are very saddened and depressed. Patient usually think like why did it happen to me, and there is a very depressed environment and scenario. So we would advise like patient should be think like nowadays the diseases are common, and by chance they have they got this disease, but good treatment is available with the specialist hand, and very soon they are going to be better. And regarding the side effect of chemotherapy, so we have enough number of medicine to support or negate the side effect of the chemotherapy. Usually the side effects are nausea, vomiting, the feeling of not eating anything, and some type of the weakness, but we have good preventive measures for that. And mental health is also very important, because if patient thinks like I am just going to die because I have this cancer, then the therapy also will work less and the result will not be good. because he is not coping up with the treatment. So we advise like they should think positively. They should focus on the effect of the treatment, not the side effect. If the side effects are there, they should discuss with their clinician. We have the remedy for almost everything, so you don't worry about that. And positive thinking is like you are going to be better, you are going to be cured, and your pain and suffering will be less. So this is a positive mindset. If the patient got depressed, caregivers also get depressed, and their family members also. So patients should keep their spirit high. Caregivers should think positively, like your patient is going to be okay, and this is the time and journey which you need to pass with the patient. And sometimes patient may demand unrealistic things, like they are very weak, or they can't move, they can't eat. Yeah, then also patient's caregiver should have a patience, because it's their feeling, their tolerance to the chemotherapy, their weakness, which is provoking them to behave like that. So they should keep their calm, and just make a very healthy or familiar environment, or friendly environment, and encourage them that you are going to be okay, better, and your health is precious, you are precious for us. And should not put pressure on them, like you should eat this, eat that, or otherwise you will not be going to okay. So this kind of the you can say the methods they should apply. They should encourage them to do gentle walking or exercise, or make the facilitate their daily routine. And whatever they want to eat, or they want to make some new dishes, they can support that. And they should discuss the positive things only, not like their neighbors are having cancer and he died, they died. This kind of the things should not be there. And very positive environment should be around the patient. Positive means like there should be some hope and light in their deeds and speaking things. Or they can arrange some prayers also. They can ask them to listen good music, whatever they like, patient like, they can do that. They can play with the patient, they can have some enjoyment things, entertainment. And they should not restrict their small kids to sit behind the patient or sit together. There is no restriction for eating together. And this kind of the familiar environment ultimately helps the patient, because otherwise if they are kept alone, they will feel like as we are having this deadly disease, so we are going to die, and our caregivers has left us. So there should be a very great bonding with the patient, and we need to understand them. And if the patient is bedridden, or even doctor has said his disease is uncontrollable, then also patient's relatives should behave like you have done well in your life, and we are there for helping you. There should be no pain, no distress. There are enough amount of the analgesic medicine, painkiller medicine. Generally the caregiver says like, if we give this kind of that much medicine, your kidneys will fail, your it will have a wrong impact on your body. But we should not say like this, because sometimes patient's life is limited after the disease. So that time patient should not feel pain. So we have enough amount of the different painkiller medicine, which should be given in liberal amount to reduce the pain and suffering of the patient. This is my message to that. Lung Connect is the patient advocacy platform. It is the India's first platform, and I'm sure it is going to rock. And it is the one platform which can help the millions of the patient in the nation and outside the nation also. And I wish all the best for that, and appreciate the effort of the team members who is making this happen. And I request, please join Lung Connect, and you ask your neighbor and people who is suffering from the disease to join the Lung Connect, and they will get good results after that.